Hello.
Yeah.
So, what would you like to discuss today?
Um, it's a few things, but I think the term that would be used now in safeguarding or social care or in kind of any arena, it's got the term disclosure. And I just wanted to think about it's been on my mind a lot, really. I've forgotten about the first time I disclosed, but it's been very much in my mind recently. Basically, for me, disclosure means telling somebody that I was abused when I was a child. And obviously, working in social care, it was all the policies and procedures about how to deal with disclosure and stuff like that, which is fine when it's in a policy, but in practice, in reality, it's very, very different for everybody.
I guess as well, it's just the very words the language that we use and stuff. It's like for a child. If you were to use a child's language, the child wouldn't say disclosure, would they?
No.
So probably some children won't know what that means at the age
Mm,
that happened to them. And the other thing that we've mentioned before is how we for a child it's called child abuse, and for an adult it's called rape.
mm,
It's not rape to be. It's not she's being adultly abused. Do you see what I mean?
mm,
So it's how, again, in my words, is just that in society things are very fickle,
mm,
and the and it's even worse for a child. And yet the word rape can be hard for people to hold, and
mm,
yet abused. Um, it doesn't really cut the mustard, really, does it?
mm.
As we spoke about before.
I think it's
So
minimised. People want to make it
it's
sound better
minimizing,
than what it is.
yeah. So it's like almost minimizing that for a child, that a child's being attacked by a grown adult
Mm,
and is, in their tiny bodies, they're being, raped.
mm,
Do you see what I mean? Their bodies are being attacked by an adult. And so to use the word disclose, we use these certain words, almost like fluffy words,
mm.
to use your
Yeah.
terminology. Yeah, so it's that where they're just telling somebody because they want help,
Mm.
and so it's for you. How did that feel when you first? And I'm going to use the words told somebody.
Um, this is where I find it difficult, like looking at policies and procedures and anything literature that I've seen about telling somebody disclosure or whatever. I've told people in very many different shapes or forms throughout my life, and I've told it how it was for me at the time. When we've talked before, I've explained that it was early childhood, 5 or 6, when it first started happening. And at that time, I didn't know what abuse was. I didn't know what sex was. I didn't know what anything was. So I didn't
And you
know.
certainly didn't know about policies and procedures.
No, and I didn't know. All I knew was what something was happening that I didn't like. But at that time in my life, there were a lot of things that were happening that I didn't like. I had to go to school. I got told off when I did something wrong at home. And so there were, for me as a child at 5 or 6, it was just like one of those other things that I don't like, but is happening regardless. And even if I say, no, I don't want to, it just
Adults are going to
happens.
force you to do
Yeah,
it.
it's
Yeah.
just going to happen
And
anyway.
so then what you're seeing is that at that time for you, you have no human rights
No.
because you're forced to go to school.
Mm,
You don't want to go, but you're forced to do it because, oh, well, this is what we do. This is what we do on this planet. We
mm,
go to school. And so and in that you're going to get separation anxiety, so you're going to
mm,
suffer that trauma. And then because we've normalized that, it doesn't really matter,
mm,
really, does it? And then so then then you're being raped
mm.
as well.
And like just at
And
school, I put it, even though it might be hard for somebody to see, but when I were like that age, you made like school dinners. I don't like jelly. Eat it. I
yeah,
don't like it.
yeah.
Eat it. It was one of those things where I didn't want to do. I don't like it, but my voice was ignored, and I listened to the older person. It'd be like, yes, you will. You'll eat the jelly.
Well, you
I'll be
didn't. You
sick
didn't have a
then.
choice then because
Yeah.
you bear a consequence.
And
don't you?
and that's what I felt like with
So-
what was going on.
So your world was full of abusive adults
Yeah.
that were forcing you to do
And that's what
things.
it felt like to me as a child.
Yeah.
It-
Well, that's what it was.
Yeah. And it just felt like it was me who had I ended up feeling it was me that had the problem. So I didn't feel that I had something to disclose, something to tell people. The response, as it continued happening over the years, my behaviour and thoughts and feelings changed, but I didn't know it was in relation to that. So again, I still didn't feel I had something to tell anybody. And I struggled with daily life after that, trusting people, withdrawing from friends, school, all those kind of things. So I had enough getting through the day to deal with without bringing up just something or nothing that I didn't like. So
Where did you learn that phrase from? Something and nothing.
it must be just from around me. It was like, for me, I didn't want to make a mountain out of a molehill, and I know I've used
There's
that
another one as
in
well.
so many throughout therapy. That's I'm making a mountain
Yeah.
out of a molehill
Yeah.
and things like that. So I felt very much that I didn't have anything to say as a child.
Well, everything that you did say was already orchestrated, so you wouldn't speak because there's these terminologies that you learn growing up, that to literally minimize yourself, that anything that was going on for you as in your interpretation was deemed as unimportant because you're just making them out of a molehill.
And things that I did say relating to it as a consequence, mainly about my body developing when I got to like 11, 12 and that kind of thing. I hate my chest, and I call it chest. I couldn't call it boobs or anything like that. We're like, I hate my chest. And my mum's reaction would be, some women haven't got one, they have to have them taken off with cancer, you should be grateful. And when I did express myself, my unhappiness about me or about things, it was sort of like dismissed, minimized, trivialized, and that kind of thing. So again, I didn't feel as if I had something to disclose. The only thing,
I guess there was no investigation either. It was like you're constantly being shut down for whatever you were saying. I remember when you spoke about when you'd said that you could be a certain way from the waist down if you were just like dolls from the waist
I
down.
wanted to be sewn up down below, as I said it. It's like, I don't see the point, particularly when I started having periods in development. It was like, I hate my body, I want to cut bits off it, I want to, it's like an other. And that, I guess, that was a way of telling somebody, but it was just seen as, you're a bit odd, or, oh, just shut up, or you're a bit quirky, or you're a bit weird, or, oh, that's a good idea, isn't it? You know, and I go, I don't want to go to the toilet, because I hated sitting on the toilet, because that was a time when, the very rare time when I didn't have any underwear on. So I found it really difficult to go to the toilet and sitting in, and I used to say, I hate going to the toilet, I want to be sewn up down there. And it was like, oh yeah, that'd be a good idea. It is an hassle, isn't it, going to the toilet, but not exploring why I was saying those things, just looking at it on a very superficial level. And that went on.
Is that realization of being in a superficial world?
Yeah.
We just look at things at certain levels.
Yeah. And it were like, and I guess it were like, put a smile on your face. It don't matter what you're feeling inside. Or I can remember my mum saying about other young people and kids, we can take you anywhere because you know how to behave. You can sit, you know, like when you went to like a meal or a pub meal or a restaurant when there were kids running around. Oh, I can take you anywhere. You know, you just sit.
You look so compliant.
And sit and all this kind of thing.
Well, is you always use a term, this, that, and the other. What is in this, that, and the other? What does that actually mean?
I guess that means those things that were important and significant, but I learnt from those around me to dismiss, minimize, trivialize or even make jokes of,
This,
you
that,
know,
and, yeah. So
this, that, and the other.
what meant going deeper.
Yeah, and oh no,
into
we
what
didn't do
was-
anything like, we weren't
no.
a family where we talked about feelings or anything like that. And we were only a very small family, but it was very much the here and now, sweep it under the carpet, you know. My mum and dad, well, my mum, shout about it, get a bit angry, forget about it and move on. You know, if you're having an argument with somebody or anything like that. We weren't a talky or a feely family like that. You know, I remember watching films, and I learned at a young age, it's pointless letting people know how you feel, because they either just ignore it or use it against you. So I can remember watching a film, and it was sad. My mum and my sister were crying at it, and I wasn't. And I was like, you're hard, you are. You've got no feelings, you are. But I went and cried on my own, because I'd learned, don't cry in front of people, they can use it against you. But then not crying, I was labelled as hard and not feeling and that kind of thing. So there were ways that I told those around me that I wasn't happy as a child. And when I was in therapy and I started psychotherapy, we sort of like looked back. I went to psychotherapy with eating disorders and OCD, and having been in hospital for depression and other labels that they'd given me, and I hadn't got better from being medicated and being refed and all those kind of things. So I started therapy, and once I'd got
How
over,
can you? Sorry, Dad, I'm going to say, how can you get better from being medicated? How
that's
do you, it doesn't
no,
even make sense in a sentence in its own.
No.
If somebody medicates you, how are you going to get better from that? You know, like when somebody say medicates themselves from drugs, which is similar thing anyway, because it's drugs and chemicals. How can you get better then from shutting something off?
Mm.
It's like the same. It doesn't make sense, does it? It's like if you were shut up, and as you grew up, you were kind of medicated in a verbal sense, in that, you know, just shut up and move on and think about something else. We don't talk about those things. So that's what you did. Do you see what I mean? You kind of medicated your crying by saying, I'll go and take that somewhere else. So I won't do it here. So I'll shut it up. Do you see what I mean? But you never got, how did you get better from shutting it up? You don't get better from shutting something up, do you? So when you say, well, I didn't get well from medicating my body, and I just shut it up. It just seems like a nonsense sentence.
It was the medical professions that were on that were the team that looked after me at that time, and I'm saying it were like in a 10 years in that 20s when I was in and out of hospital and inpatients, outpatients, and day patients, and it was all about, yeah, we'll try on antidepressants, that'll get you sorted. We'll have a stint in hospital, that'll get you sorted. We'll refeed you. We'll do food diaries. We'll check your bloods. We'll weigh you.
The human doing.
Yeah. And it was like, when they're like, oh, you're not getting better, like we thought you would, because once you've done all these things, you're supposed to be better. It's like, oh, well, you're not. So I got the label borderline personality disorder, because then they could say, we just have to manage you because you're never going to get better. And it was only me saying, I'm fed up of being like this. I don't want to learn how to manage. What else can I do? After 10 years that it was, well, we could try psychotherapy. And I was like, yes, please. I don't want to carry on living like this, because it was horrendous for me. And it was in psychotherapy that once I stopped talking about all the labels and the last 10 years of being refed and medicated and that kind of thing, we looked at me and started talking about those things that we've talked about, what I was like as a child, what I'm like as an adult, why as an adult, if the telephone rings, do I like, oh, don't want to answer because I don't know who it is, I don't know what it wants, I don't know. And why as an adult, I can't mix with people socially, and I fear people. And we started talking about that. And after a long time, I just said, and what happened when I was little. And that was the first time I've ever said anything. And I said it as that 5 or 6 year old child up to that 10-year-old child.
So
I said it like, and this, and I could feel this, and this happened, and this, and this. And I was assuming he knew what I was talking about, because I'm going, well, and and this, and then this, and I remembered this, and this felt like this, and then I wondered what were this, and I just thought, oh, and all that, and I'm like hoping that he understands it, because that's how I remembered it as that child. And when we talked about that, he was the one who reframed it in adult language and told me that it was rape, child sexual abuse. And I was like, you're obviously not hearing me right. You're obviously not listening to me. You've got it wrong. It's just this, and then I felt this, and then I knew this, and then next time this. And it took me a lot of time to actually accept what was being said.
Yeah.
But that was what I think in the policies would be my first disclosure that I verbalised to somebody. And I was about in my early 30s.
Mm. So you kept it in all that
And
time.
I'd not forgotten, but I've not given it much thought since then, because I've been dealing with a lot. But actually that very day, my second disclosure happened, because this happened in a therapy session, and it was a very time limited therapy session, and this, that, and other. So it was ended, and I didn't show any emotion in the session. I was just saying, you're not listening to me right. But I knew he was, but I just didn't I wanted him to have got it wrong.
Yes.
And so I got in, and he said, like, we checked, are we safe to leave and all that kind of stuff. Got in the car, because it was a Friday morning. So I had that hour off work. So I got back in the car, drove back to work, got in the car park, just started sobbing and couldn't breathe and felt so overwhelmed with everything. A colleague rang me, and I answered it, because I go straight back to work. That was the arrangement. I have an hour off, go for my therapy, go straight back to work. So I was back in work mode. I answered it, and she was asking me something about work, and I just couldn't breathe. I was sobbing, and she's like, she was an hour and a half away from the other side of the region. I'm coming, what's matter? I'm coming. And I was like, no, you're not. No, you're not. I've got to go back to work. I've got to go in the office now. And I ended up, he said, this has happened to me, and I don't want it to be that. I want it to be something and nothing, and that. And that was the second time, or whatever you want to call it. And after that, stayed on the phone with her or whatever. But then it was like a switch went off. As soon as I finished that phone call with her, I went straight back into work and carried on straight with my job. And then it was a long time after that before I even shared it with anybody else, because I was working through it myself in therapy, that I didn't feel able to tell anybody else outside it. I was working through it with him, and about trying to accept it and understand it myself. And then from then, telling people, it's been very different. My mum, it was by accident, and I didn't mean to tell her, but I felt as if I was caught in the headlines. A friend who I'd known for 10 years, I couldn't tell her verbally, but I wanted her to know, because I felt like I was lying by not telling her. She knew about my eating disorder, and she knew about that I'd been in hospital with depression and stuff, but not about the root cause of it. So I gave her my clinic notes on a piece of paper and said, and that's why I've got them, and gave her it. And it was like, oh, right. And I said, if there's all you want me to ask, you can. And it was just like, all right. And that was it, done and dusted. My family, my sister, I didn't need to tell her. I didn't need to tell anybody. My mum did it for me. She told everybody.
Wow. What did that feel like for you, taking it out of your hands like that?
In a way, it was a relief, but in a way, I wasn't happy about it, because I don't know what she'd said. She told my sister, and she told some friends of the families that we used to like go on holiday with and spend time with and stuff like that. And she even told my GP, but I didn't find out about that till long after I was going from a GP about something else. And I said, have you told him? She went, no. I said, are you sure? No, I haven't told him. I said, well, I'm going, I've got an appointment on whenever. Oh yeah, I have told him.
Wow.
So going to my GP, I thought I knew you would have done. So going in my GP was, I know you know, my mum's told me you know, but I've come about this. And it was something about, well, I did have shingles at the time, but I've come about this. I want some antivirals. And it was never mentioned again. And that seems to be the theme from those around me, that when they do know or I disclose, it's, and then we don't talk, it's said, and then we don't talk about it.
Yeah.
I find it a lot easier to do and have our videos out there and do talks like I did a couple of weeks ago to a group of social workers, and I've done to nurses or in schools and stuff. I find it easy to talk and do a presentation or do a session or a workshop or a school assembly. But just before Christmas, somebody I know, a friend that I'd known for 10 years, I thought, I'm going to have to tell her. We're going to an exhibition, an art exhibition, a portrait exhibition, photography, and I'm in it. And it says a little bit about my story. I thought, she's coming with me. She asked if she could come with me to see it. She thought it was about mental health because I'd said, oh, I did a photograph for mental health. And, oh, I'd like to come. And it wasn't until we were on the train there, I thought, I'm going to have to tell her because I don't want her just to stand in front of my picture with that. That's not right. So I had to tell her in a way that I felt comfortable with, which was on the train, on the way. And I just went, you know, that the exhibitions about mental health and stuff like that and people's experiences, everybody who's in it has experienced child sexual abuse, and I'm in it, so that's what I've experienced.
Do you still
And that
use
was it.
that?
That was it.
Is that easier, that word, though, as you say, fluffy words? Do you still use that to save others almost from saying rape?
Two things, I think, for two reasons why I didn't say to her, oh, by the way, I was raped when I was 6. I sort of said, oh, because others have experienced it, so I've left it like that. It's not because I'm ashamed or anything like that. I'm not ashamed. I didn't do anything wrong. You know, I'd feel no shame, no guilt or anything like that.
Yeah, you should.
But I know some other people do, which is how they're feeling, and I'm not discrediting that, but I don't feel any shame or guilt to it. But I get fearful of people's reactions because two things really. When I've always read, because I worked in schools and stuff like that, and we had safeguarding policies and stuff like that, and it was always, if anybody discloses, because that's what the term they use, don't respond in a horrified way, don't respond in a shocked way, don't show any emotion and this, that and other.
Wow.
Well, for me, if somebody did that to me, if I said, oh, I've been raped or this had happened, I would, and they just sat staring at
with
me.
No emotion.
Yeah.
As a human being.
Yeah. I'd be like, I were right, I'm making something out of nothing. I'm making a mountain out of a molehill. Yet, if somebody went, oh, that's horrible, that's all, I have to deal with them rather than me.
But no, also they have to, you know, it's one human to another. If a child says something, to tell somebody not to react, it's like shut your emotions down. And then when you shut your emotions down, you're going to, you know, potentially shut the child's emotions down, and then solidify that your emotions are valid here, or that it's not a place for emotions. When we're human beings, when are we going to start being human beings?
Because if somebody did that to me,
instead of having a policy or somebody's idea,
if somebody did that to me, I wouldn't think, oh, they're reacting from their policy and guidelines. I would think they don't give a toss. They don't care.
Exactly.
I'm not saying anything
I'm a
important.
professional, so I don't react in that way. It's like, when does any made up label come above human beings? I mean, when are we going to start treating each other for what we really are? We're human beings with thoughts and emotions in a world that's saying, or a lot of it saying there's no place for that here. That's insanity.
And so that's my hesitation about telling people. Over time, it was because I couldn't verbalise the words. I used to get stuck in my throat.
Well, you just then felt like an object. You felt like an object, and that's just my guess that, because you were definitely treated like an object. And then for somebody not to react would just be like, see that leaf's got a bit of dryness on it.
Yeah,
There's
as if I was talking about my Morrison shopping or something like that.
So then you can see how that impacted you, because quite often, and I get what you're saying, is that not being able to cope with what you've just said. So almost what we call drop a bomb. You drop the bomb and you can leave then. While the bomb blows up. Do you see what I mean? So then you can leave. But if you tell somebody that's close to you, you have to then deal with the shrapnel of that. And you found that difficult in, when it was disclosed, the shrapnel, this is what's actually happened to you, that somebody's validated what's happened to you. You'd learn that, well, we don't go there, so I can't cope with that.
And it scares me because I don't know if I knew how they were gonna respond. But I can deal with 300 people and talk about it, and
but
this,
not
that, and
anybody that's close.
Yeah,
so
not
300 people. You can just almost see them as an entity in itself, an objective entity, rather than having a personal human experience with each individual. And so, also it can be difficult when people have gone through any kind of trauma, and then they're having to sit with that trauma. It could almost, when you feel that you're just going to lose your mind if you really accept this. So you have to try and do something with it. Like when people, are in road accidents and they're going comas because they're coping with the trauma. It's too much, so the body tries to protect it. And I guess it's that feeling of, I can't cope with the reality of this. It seems panic.
When I just feel that I dread what their response is going to be, whether it's going to be dismissive or whether it's going to be shock or something. It's like, I'm going to have to deal with them.
Yes.
And that is frightening for me. But also, I've completely gone blank what I was going to say, but I was going to say something. Hopefully it'll come back to me. But there's also that about, I don't know, when one of the things that I found so helpful and meant so much to me, and I know it'll probably sound very minimal, but it wasn't. When we say about people's response and stuff, to be taken seriously, that's all I want. And obviously trusting people and stuff is a big issue for me, and I didn't want to admit that I was in a relationship with my therapist. No, I was just coming for therapy. It wasn't a relationship or anything like that, or working together. I was coming for therapy. But when I said to him, I've seen him yesterday, by his expression and body language, I knew he knew how significant and how that would have made me feel. And that him showing that recognition and that emotion, I felt understood for the first time in my life.
Well, it's relatedness, isn't it? That somebody had related to you and expressed that rather than having no expression whatsoever. They, were managing it with you, almost like you were doing this with somebody that was really.
They understood what, and they would have known. He knew what I was talking about. I didn't have to say it. I just went, I saw him yesterday.
And that you weren't all the names that you've been called, that you're weird or you're this, that pushing away. Almost this was pulling you close and saying, and especially when you validate it through words or terminology, and it's like you went through that. And there's somebody there with you, that they're with you doing it. They're not overlooking you. They're not, judging you or telling you that you're the object. They're actually in there with you. They're getting down in the trenches with you. And it's that.
One of the fears of telling people, it's just come back to me, one of the fears of telling people, which is probably the big fear, which is why I wanted to dismiss it, because it's something that I hate to think about is often, or I assume the first thing that somebody's going to ask me is, who were it? Because that generally is that is generally the first question that I have said.
Yeah, and it's that way.
And I feel that I'm a rabbit caught in the headlights.
Yeah.
I feel put on the spot, and I don't feel comfortable saying, because I'm not confident, and I don't want to upset, and I people please. I don't feel comfortable when.
Yeah, because the fear of telling, the
Yeah.
fear of the consequence, if that, for you, if that person's known and that you're still scared of that person. So the fear of telling, it almost like, it's like when people, when people are being attacked, everybody's more interested in the perpetrator than they are the victim. So the victim often gets forgotten about. So they can just build a story in their own mind about the story, that the narrative that they want in their own mind. Who was it? So I can build a picture. And it's like, why? You don't know them. You don't know me. You're not in my life, because some of these people that have asked you aren't actually in your world, are they really? So apart from if you do a talk or whatever, that it's like you're just interested in building a picture that this person did that. But it's about you. It's about, why do we need to know who it was? Ultimately, we know that that happened to you. Do we need to know who it was? Or, or is it something that the authorities need to know? Well, they're, because you'd expect them to ask you.
Yeah.
But
No, it seems to be an individual thing. They want to know who it was, where, how it happened, and this, that, and all that. Not
going into
how does
detail.
that feel for you?
Yeah, instead of going into asking, please my ego by answering my questions that might be uncomfortable for you. You see what I mean? The only people you want to tell that to, ultimately, like I say, is either the police and your family members, because they're likely to ask, who was it? But other than that, when you're saying it to people outside of that, it then objectifies you, I'm guessing, in a way, because it's like, you're just interested in the story of it, but actually now we've moved away from me, from what I'm saying, because you're now asking me to give you more details that you want.
Yeah, because some of the questions that I've been asked when I've done talks on it is, normally when I say, is there any questions, and I'm open to any questions that help me learn. They might pick up bits that they feel are important, but I don't feel are important, and stuff like that, or bits that I forget. So I do ask for any questions, but it's often the questions are, who were it, where did it happen, and all that, how old were you, and all those factual things. Or if I do say, well, I did see him the other day, or whatever, it's where, what they're doing, da 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 da.
What does that make you feel?
Nobody goes, how does it feel seeing the person
that did that to
you? That did that to you when you were little? Nobody's once asked me that. Nobody's once, how confusing how does it feel when you're a 5-year-old?
What does it feel like when you see that person?
It's changed over time. It's changing. At first, it was, up until recently, it was still absolutely petrified, and I need to get out of the way.
Yes.
Please let me escape. I feel trapped. I need to get away from them and run, and normally did. I'd normally freeze, but want to run, freeze, and that kind of thing. Lately, it's been more, I've been, as in talking through things with you, I've been more wondering. I wonder what, never mind about me, what I feel. I wonder what they feel when they see me.
Yeah, giving yourself that space.
Yeah.
Didn't you? You felt a bit of space.
Not just looking at my body reactions,
into your reactions
and going, quick, get me out. I've started thinking. I've started thinking and wondering.
And seeing that actually sometimes when you're an adult, although for you, when you see that person, you get triggered back into the child self. As the adult, you can often be a threat to that person, because the threat of you saying something to them, the threat of you shouting something to them, the threat of you telling people about them. So they're now under the threat. And they've always been under that threat, really, of it being told, because, that's why majority of people, perpetrators, deny it. because they become the cowards that
Yeah.
that
They
deny
don't
it.
go around saying, you know what I've just
You know what
done, do
I've
they?
just done? Yeah, I mean, some sociopathics and psychopathics might. Not that every psychopath or sociopath's a rapist, but they, because they don't care
Mm.
enough to bear a consequence. They're not bothered about that. But it's some they do care about bearing a consequence, so they usually deny it.
But I think things are changing. My body still reacts. It wants to run. It wants to flee.
Yes.
Or freeze. Or both at the same time. It's like, what do I do? What do I do? But I think my thinking is evolving.
Yeah, so you're giving your body some space rather than it reacting in the fight or flight. You're giving it. Well,
I'm noticing, is it still there? Yes, I'm still getting that same reaction and that kind of thing.
But now you can look at the reaction more than being in the soup, as I say. You're actually looking at the soup.
Yeah.
Yeah. Are you okay to?
Yeah.
Okay.
Thank you.
You're welcome.